Welcome to the Contra Costa County Eldercare channel. My name is Stephanie. I'm the Marketing Director for Horizon Elder Law, as well as today's host for the Contra Costa County Eldercare channel. Today I'm here with Dr. Mimi Salamat, who has a PhD in audiology with a minor in counseling. She also has 2 master's degrees, one in speech-language pathology and the other one in audiology. Dr. Mimi's postdoctoral research has been in cognitive and speech processing difficulties and brain mapping projects. She is also specialized in tinnitus management. She was formerly on the faculty at the Washington State University Audiology program and was senior scientist at the Oregon Health and Science University Tinnitus Clinic. Her papers have been published in the Journal of American Academy of Audiology, a Tier 1 peer-reviewed scientific journal. Her dissertation has won the Best Research Award from the American Academy of Audiology. In addition, she has given numerous presentations at national and international conferences and symposiums. Throughout her professional career, Dr. Mimi has trained many audiologists and taken care of numerous patients with hearing, tinnitus, and balance disorders by prescribing hearing aids, auditory training, and rehabilitation techniques. She has a certificate of clinical competence in audiology from the American Speech and Hearing Association and is a fellow of the American Academy of Audiology. Dr. Mimi has over 31 years of experience in the field of audiology and hearing aid technology. She also has audiology and hearing aid dispensing licenses in 5 different states, including California. Dr. Mimi makes house calls for her patients who live in the Rossmore and Byron Park communities at no extra charge. Thank you for joining us, Dr. Mimi.
Thank you for inviting me.
We're very excited to learn more about what you do and how you can serve our community better. So, what are normal symptoms of hearing loss?
Very good question. Hearing loss is a gradual problem, and people are not aware about that when it happens. They usually complain that other people mumble, or they have difficulty understanding when they are in a group, or they are in a function, and they make TV louder, and they ask for repetition, and when someone is further away, they hardly understand what they are saying. So, and these symptoms are very gradual, but when they combine, they cause a lot of problem for their social interaction and communication with their family and people around them.
Excellent. Well, I wish I would have known that many years ago when I was helping my grandmother who had a lot of hearing problems. Well, who should people see if they're experiencing hearing loss?
Well, very good question. Again, this is, you're talking to an audiologist. As audiologists are the trained professionals that are university and medically trained to take care of the people with hearing and balance disorders and tinnitus. And however, there are other groups in the field that basically they sell hearing aid, but they are not audiologists. They are not trained in the field, and they go by different names, hearing aid specialist, audio prosthologist, or hearing instrument specialist. So, we believe hearing aid is a medical device, and it has to be in the hands of medically trained professionals. I think it's for the best interest of the public. They need to seek the help of a professional, which is the audiologist, and we have a strong association with a strong code of ethics, and I think it's for the best interest of the public to see a professional that is medically trained to take care of them.
Excellent, thank you. So we see a lot of advertising for hearing aid specialists and various different titles. Can you just elaborate on what the differences between those are?
Yes. As you mentioned for your introductory part, I used to be a professor, and majority of my career has been in academic. And a few years ago, when our program closed because of budget cuts at the Washington State University, I started my private practice. And I become very aware of the type of advertising that I was seeing and also the patient brought to my office. And almost 98.5% of them are from the people that are hearing aid salespeople, or they call themselves hearing aid specialists or dispensers. And they basically sell hearing aid. The requirement for audiologists in the state of California is to have a master's degree minimum, and with 2,000 hours of clinical practice under their belt. But these people that sell hearing aid, based on the requirement is to have a high school diploma and a few days training with a company. And the majority of them only work with one hearing aid company. And all the advertising that people see in the paper or comes to the mailboxes are through these salespeople and are sponsored by a hearing aid company. So when people respond to those advertising, they are bound to get that model, that brand. It's like when you hear advertising for McDonald's. You just go and you get the menu of McDonald's. So that's the difference. And anybody that doesn't have the name of audiologist under as part of their credential, they are basically salespeople. They are also people that have other degrees, bachelor's or master's or even a PhD in completely unrelated area. And sometimes my patient says, but the person had a master's degree or a PhD, and I said, in what field? It seems like if you have an eye problem, you go to a person with a PhD in political science. It just doesn't work. PhD is a respectable degree, and we work very hard. But I think people should work in the area that they are trained for. But not every PhDs are qualified to take care of the people with hearing problems.
Makes complete sense to me. So does every person who is experiencing hearing loss need a hearing aid?
No. Some people, they are different type of hearing loss. There is a type, we call it conductive hearing loss. For example, if a person has wax in their ear canals, or they have their eardrum was ruptured, or there are 3 little bones in the middle ear that it would be ruptured, or maybe they are having a tumor under auditory nerve. These people have to be checked by an otolaryngologist or ear, nose, and throat specialist. You know, I'm glad you asked this question because I've also seen patients that have been fitted with hearing aid by the hearing aid salespeople, and while their primary need was to be checked and to be medically and the physiology, anatomy of their system to be okay, and then they can go for hearing aids. But not every person that is experiencing problems should just be fitted with hearing aid. We have to check the system. And this also goes with a lot of people get hearing aids on the internet. And I am just appalled how would they do that, because they have to be medically tested. They need to be, people need to know what is the degree of their hearing loss and what causes their hearing loss. You know, I saw a couple patients with tumor under auditory nerve, and somebody fitted them with the hearing aid, and it's just, I think it's unethical and unprofessional, and people need to know where to go and who to see.
Absolutely. That's terrible. So in my experience, there's been a lot of people are fearful of wearing a hearing aid for various reasons. Can you share a little bit more about that?
Yes, it's, and many years ago when audiologists were not dispensing hearing aids, they were the middle group that which was the salespeople that start selling the hearing aids. And when you have limited knowledge, whatever you are doing with the patient, it's not adequate. Millions of people have hearing aid that they are not using, and they are putting it in the drawer. because they say it's buzzing all the time. It's they don't hear very well when they are with a group, or they hear a lot of noise. And also hearing aids are expensive, and it's a major um, investment for the people to do that. And then for that, hearing aids got a very bad rap, that hearing aid doesn't work, it's expensive, and when they go to these offices, they just want to sell them something. They don't want to serve them. Some people need auditory training, some people, they have auditory processing problem, and and people are not even familiar with the name of audiologists. We are not a household name, so, and that's why I think people are very concerned, and they are afraid to even start getting a different kind of hearing aid. A majority of the patients that I see in my office are referred by my other patient, and when they come in, they have absolutely horror story about their previous experience, and I understand that, and I respect that, but people need to know who are the true professionals in the field. If they have made a bad mistake, it's not the fault of the hearing aid. Right. They should be aware where to go and who to see. Hearing aids and the field of audiology and hearing aid has gone through evolution and revolution for the past even 15, 20 years. And hearing aids are very useful devices and can make a big difference in the lives of the people. But it has to be in the hands of the professional. But I understand the fear and hesitation of the people.
Absolutely, so do I. So are there any drawbacks to wearing hearing aids, such as worsening hearing?
Very good. It is possible because there is a limitation. People, they have a degree of hearing loss. We measure them, how they hear the soft sound, the medium, the normal sound, and what is the limit for hearing the loud sound. If the hearing aid is not programmed properly and present very loud sound, yes, it could affect the hearing of the people. In many cases, people that are exposed to the loud sound, hearing in many cases can be preventable, that they don't expose themselves to the loud sound. So if the hearing aid is not properly programmed, then if they also hear sounds that are not clear, because of the plasticity of the brain, it means like garbage in, garbage out. If they don't hear the sound properly, the brain processing does not take place properly. And yes, it affects their speech understanding, and it might affect their level of hearing.
Absolutely. So some people who have hearing loss also get a ringing or a buzzing sound in their ears, which is called tinnitus. What is tinnitus exactly?
Tinnitus is defined as unwanted sound inside the ear, or it's with the latest theory, it shows that it's created in the brain without any external sound. There is no sound coming in, but people hear that sound, and it can be buzzing, chirping, or even some people hear music or a song. Or I have a patient that she says that she hears Silent Night, but that's better than the buzzing. But it's very disturbing. They can't, it affects their sleep, it affects their concentration, it's affects their emotional well-being, because basically it takes their peace of mind away. And majority of the people that have tinnitus, they also have hearing loss. It could be a different degree, but a lot of people are more disturbed about their tinnitus than their hearing loss.
So oftentimes their primary care doctors or a different doctor in a different field might tell them just go live with it. So what do you have to say about that?
I think it's just completely unacceptable. This is a prescription from a physician that there is no pharmacy can fill that up. It's not correct. There are many different ways that we can manage people's tinnitus. At the present time, we don't have exact cure. You have a headache, you take a painkiller and it gets better, but we don't have a pill. There are lots of things even on the market which none of them are scientifically proven. And so there are different ways that the audiologists who are trained in tinnitus management can take care of these patients with their tinnitus problem.
Well, excellent. What are the side effects of untreated hearing loss and tinnitus?
Wow, that's a big one, Stephanie. It's research has shown that untreated hearing loss affects memory, short-term and long-term memory. If people look at Google side effect of untreated hearing loss, they will get pages and pages of that. And then also hearing loss affects emotion. People that have hearing loss, they are more prone to depression, anxiety, isolation. They don't want to go with the crowd. It's because it's a bunch of, they call it mumbo jumbo. They don't hear, they can't connect, and they get separated from people and family, and many of them misunderstand, and when they answer a question it's wrong, and people label them as being senile. If you misunderstand cat versus pat versus hat, your answer would be completely different, and that people think they are losing their mind. And because physiologically the auditory system is in both part of its temporal lobe, and our memory center is in the middle. It's the hippocampus, called hippocampus. It's extremely vulnerable. When the hearing goes down, it would affect short-term and long-term memory problem. Latest research from Johns Hopkins shows with Dr. Lin that majority of the people that were diagnosed with Alzheimer's or dementia, their primary problem was hearing loss. That's why I always tell my patient that the side effect of hearing loss is more problematic than hearing loss by itself.
Wow. Well, this has been very informative. Is there anything else you'd like to add?
I think your questions were just wonderful. I think we covered all of those. And what I want to say is, people say I went to the doctor and said I have a high pitch hearing loss and I'm not candidate for hearing aid. I think they need to check with an audiologist. It's and I always have the analogy, like if your arteries gets plugged up, you can say, okay, I'm going to wait until it fully plugged up. Then the side effect would be a heart attack or a stroke. So when people are experiencing hearing loss, they need to take care of it. The sooner they take care of it, the better it's going to be for the function of their brain, for their speech understanding. They would not get the side effect, would be majority of them tinnitus, and the brain nerves in the auditory cortex would not be get useless, and then in that area would not be activated adequately, that their speech understanding would be good. A lot of people say, I hear, but I don't understand. It's just the system that is going to stay constant. It's like a huge piano that many of the keys are taken out, are not working. When you play that, it's not musical. That's why people need to take care of their hearing as soon as they can.
Absolutely. I completely agree. Well, thank you so much for your time, and
My
thank
pleasure.
you for all of your expertise here.
Thank you. It was my pleasure. Thank you.
I very much enjoyed speaking with you and learning more about audiologists and what you do and how you help people in the community. If you or a loved one want to learn more about Dr. Mimi, or if you'd like to schedule an appointment, you can find her information on her main page at the Eldercare channel, or you can call her directly at 925-937-4455. Thank you so much for watching. We hope you have a wonderful day.